The aim of this video is to share about the emerging risk factors and problems that occur among the preschooler at their age. First, we will look at what are the three common issues, following with the findings of the studies conducted on these issues. Later, we will further explain about the dental caries, why we chose this issue as our main concern, how nutritionists should focus on this issue, and some recommendation on interventions. So let's get started. According to the selected articles, three main issues that we find out most associated with preschool children are dental caries, stunting, and autism spectrum disorder. A research about dental caries was done to find where the prevalence of dental caries is positively associated with nutritional status, sugar, and secondhand smoke exposure among preschoolers. Meanwhile, for the second issue, research about stunting was done to find whether low birth weight, anemia, presence of intestinal parasitic infections, not wearing shoes, absence of piped water at home, dirty nails, and stunted mothers were associated with stunting among preschoolers. Then, the third issue focused on the association between children with autism spectrum disorder with poor body weight status and intake of several essential nutrients.
Moving on to the findings that we obtained from the data. For dental caries, this study showed that 63.4% of the preschoolers had at least one decayed tooth in their primary teeth. In general, males exhibit more decayed primary teeth in comparison to females. Being exposed to secondhand smoke and those who had more than 6 times total daily sugar exposure were significantly associated with dental caries among preschoolers. Next, for stunting, the study showed that approximately 1/3 of the children, which is 35.6%, and 7.8% of the mothers were stunted. 1 in 5 of the children were anemic, while 1/3 had intestinal parasitic infection. Lastly, for autism spectrum disorder, the study showed that the prevalence rate of underweight, stunting, wasting, overweight were at 9.3%, 8%, 4%, and 21.5% respectively. All energy and protein intakes were adequate for most of the children with ASD, but calorie from fat was higher than the recommendation. A majority of the children with ASD in the study did not meet the RNR requirement for fiber, thiamine, vitamin C, vitamin D, vitamin E, vitamin B12, folate, calcium, and zinc. More girls show inadequate intakes of vitamin C, niacin, and vitamin B12 than boys.
Is dental caries worrying, especially among your preschool children? The answer is yes. Dental caries should be prioritized. So our issue is dental caries among the preschoolers. So this is our finding from the data. And it is higher risk among a second-hand smoker and also a person that had 6 times of daily total sugar exposure. Why should we prioritize the problem on dental caries? To justify, first, dental caries is a serious health concern that is usually unaware by adults. If adults are unaware of their child condition, they will not take preventive actions against dental caries. Second, it is because dental caries mostly due to our behavioral factors in daily life that we might not be aware. For example, a poor dietary habit such as consumption of sugary food or drinks. Nowadays, most of the food, especially fast food or sweets that preferred by the children, are high in sugar and easily accessible, thus causes the children to eat excessively and over the control. The third reason why we should prioritize the problem on dental caries is because preschoolers are the pillars of the future and should be given more attention. Their mindset and behavior are also the most easiest to change. Therefore, education and interventions about dental caries should be given while they are young so that they are aware of the importance of good oral health. The last reason to give more attention on dental caries issue is the untreated early childhood caries have significantly poorer oral health related quality of life than children without childhood dental caries. Dental caries affect the quality of life when it causing the pain, irritability, and as well as sleeping habits.
Next, how nutritionists should focus on this issue. There are many approaches that can be implemented, such as the community-based approaches. First, nutritionists should educate preschool children to take care of their food intake. Nutritionists can advise them to limit sugar intake. For example, avoid drinking carbonated drinks as it contains a high amount of sugar and are very acidic. Thus, nutritionists should advise them to increase fiber intake and drink more water, especially after meals. Second, nutritionists should talk to parents. We need to educate parents to stop feeding their kids unhealthy food that can cause dental caries. The parents should practice healthy eating and lifestyle in order for their children to follow their steps, thus help reducing dental caries problem. Nutritionists also should advise parents to reduce smoking or not smoking near their children because secondhand smoke can make their children more prone to dental caries. Lastly, nutritionists should raise awareness to kindergarten. As nutritionists, we can have mouth-to-mouth discussion or by giving posters to the kindergarten teachers and staff. This is because preschool children spend most of their time in the kindergarten during the day, especially for working parents. Hence, most of what they eat are provided by the kindergarten staff. By having awareness, kindergarten will provide more healthy foods to children.
Lastly, as preventative measures, we recommend some improvements on the existing interventions. For example, according to a research conducted in Malaysia, it is encouraged to include the intake of plant-based milks since they act as anti-carcinogen agents and help to promote enamel remineralization. This is because the plant-based milks such as coconut milk and almond milk are lactose-free compared to bovine milk, while they are also high in calcium content which helps in promoting remineralization process. As an initiative, we suggest to provide free plant-based milk samples for preschool children during preschool open day or parents meeting day. The Ministry of Health might provide allocations for the preschools to deliver the plant-based milks. Any related industry that produces plant-based milk products also could promote the benefits of plant-based milk consumption through open booths and interactive learning for parents during preschool open day. Another existing intervention is the urge of mandatory dental checkup starting in preschoolers as practiced in United Arab Emirates. Introducing the mandatory dental checkups among toddlers could be a proactive strategy to screen, prevent, and intervene early. The lack of mandatory dental checkups in this age group poses a challenge for assessing large, unbiased groups of children. An alternative strategy could be to recruit children through household visits, which would not necessarily be more efficient for recruitment as it is labor-intensive and costly. To improve this existing intervention, it is recommended for the preschools to include parents for consultation about their own child's teeth status. Therefore, the parents will receive the right information about their child's teeth status, such as the total tooth loss and the probability of having any dental caries. Indeed, parents will be more aware to monitor their children's eating habits as well as practicing prevention steps, such as reducing the sugar intake while increasing the consumption of vegetables when they are at home. Moving on to the third existing intervention, India has prohibited sugary snacking in school. How they do that? The schools make a notice of prohibiting sugary snacks in the school premises and also give an official letter to the children to inform the parents. A random inspection will be conducted during children's lunch. If the children succeed to follow for a week without miss, the teachers will supply stationeries for that month as a reward and as encouragement. The school also provides fruits and vegetables to the children. It is encouraged to serve high-fiber fruits and vegetables in creative ways. By making food fun for kids, it will help immensely in getting them to eat foods they may not normally like. As a result, it will attract the preschoolers to consume both fruits and vegetables instead of sugar snacks.
Next, Singapore has done water fluoridation program to reduce dental caries. Fluoridated water has been proved to be successful in dental caries reduction and is more effective when accompanied with the usage of fluoridated toothpaste as reported in the Southeast Asia countries such as Singapore, Brunei and Malaysia. Improvement that can be done is to encourage the parent to introduce the usage of fluoride mouth rinse among their children. Education on the usage of fluoridated mouth rinse need to be emphasized by the dentist to the parents when their children are having dental checkup at public health clinic or even private health clinic. Lastly, Hong Kong had introduced application of sodium fluoride varnish onto child's teeth. According to a 24-month RCT study conducted in Hong Kong, the intervention group received 5% of sodium fluoride varnish application. Improvement that can be done is the government can provide a subsidy for dental preventive treatment to reduce the incidence rates of dental caries among preschool children. In conclusion, much data are needed to confirm the effectiveness of this intervention. Through further research, since they cannot be simplified to conclude as gold standard intervention. That's all from the review on the dental caries issue. Thank you for watching.